now we get to turn our view to the local level. And so really excited for you to hear the real-world stories of how 2 local health departments have applied Healthy People 2020. And I think this will be a really nice addition to the overview Allison gave us. So I'm going to go ahead and invite Lakeisha up to tell us how they've been using Healthy People in Miami-Dade County, Florida.
Hello, everyone. So today I'm going to be sharing with you all how our health department uses the Healthy People 2020 goals and objectives to improve our community's health, as well as how we use it to improve our performance in our agency. So just to give you guys a little overview of what I'm going to be going through or what I'm going to be covering, I'm going to talk about our county profile as well as our health department profile. And then I'm going to go over why and how we use Healthy People 2020 and our public health model, how we use the Healthy People Map-It framework, how we use the Community Health Assessment Improvement Plan, how we incorporate Healthy People 2020 in both of those, how we use it in our strategic planning process for both the community and agency strategic planning, and then how we use Healthy People 2020 for our community as well as our programmatic health indicators. So just to give you all an idea about our county, we're the 7th largest county in the United States, being the largest county in the state. We are a very urban, multi-ethnic community with 2.5 million residents, which makes up about 13.5% of our total state population. And as a health department, we're also responsible for 12 million annual visitors every year. And in terms of race and origin, as I mentioned, we're a multi-ethnic population, having over 64% of our individuals, our residents being of Hispanic origin or being from another country, with 51.2%. And then we also have an annual immigration of 42,000 people that come into our county. So you can imagine being multi-ethnic and diverse, we deal with a multitude of different unique health situations and issues. So I'm not sure why this little thing is at the top. But anyways, in terms of our health department, we were previously known as the Miami-Dade County Health Department. We just underwent a name change, so we're the Florida Department of Health in Miami-Dade County now. We're a centralized public health system, integrated system, part of the Florida Department of Health, and we have 67 counties in our state. In terms of population, our health department is the largest. However, we're second largest in terms of budget and employees, and this is mainly due to the way that we provide primary care services in our county. And we consist of over 800 team members that are responsible for fulfilling our mission as well as our vision and values for our health department. And we're considered the lead agency in providing public health functions along with partnerships such as our hospitals we're a part of. We have a hospital consortium. We work with clinics such as our federally qualified health centers. We work with planning agencies as well as a number of community-based and faith-based organizations in order to promote health in our community. And lastly, this is something that we're all very proud of. We consider ourselves a performance excellence-driven health department. We're a 3-time Florida Governor Sterling Award recipient. That's basically our state's equivalent to the Malcolm Baldrige Award. And again, we use Healthy People 2020 also to drive performance in our agency. So let's get to the meat of this. So why do we use Healthy People 2020? Well, number one, it provides the top of the health indicators and objectives that reflect major health national concern. It's research-based, it's science-based. It basically provides a roadmap providing 10-year national objectives to improve health for health departments. It also provides established benchmarks. As Allison mentioned, we use the benchmarks to let us know how we're doing in terms of health in our community. We compare ourselves to those benchmarks. It also encourages collaborations among communities. We use the Healthy People 2020 at the table as a talking point to almost illustrate where we need to be, where we need to go, and then how we're faring in our own community. It helps measure the impact of prevention activities by letting us know we need to center our attention on other core areas or if we need to improve some of the things that we're doing. And then lastly, it acts as a mechanism for health departments to monitor health as well as make informed decisions. So I wanted to share with you all our public health model. This is very specific to our health department. And starting with the lower right, you can see what we do. We perform the 10 essential public health services. How we do it, we utilize our performance excellence model, which is the Sterling or Malcolm Baldrige model. And then why we do it. We do it for the Healthy People 2020 indicator objective core areas. So you can see in our public health model as a health department, Healthy People 2020 is very much integrated into our system or into our model. And then on the outside, we have that because we're also in the process of accreditation. That's a very important component. So one of the Healthy People tools that we use the MAPIT framework, and for those of you that might not be familiar with it, it's basically a framework that you can use as a health department to help encourage or help promote the Healthy People 2020 objectives, as well as help improve your community's health. And so the M being mobilize partners and organizations. Everything we do to try to improve our health in our community, we work with our partners. There's no way as a health department that we would be able to do it alone, so we mobilize our partners and organizations. Then we assess the needs of our community and resources available that are out there to help improve health. And then we plan by developing a strategy and approach to help achieve those objectives. We then implement a plan to reach the Healthy People 2020 objectives. And then lastly, we track our community's progress. So as I go through the presentation, you're going to see the different ways in which we use this framework and how we use Healthy People 2020 to improve our community's health. So after we mobilize our partners and our community members, in terms of doing assessment, we chose to do the community health assessment using NACCHO's Mobilize in Action through Planning and Partnerships, the MAP model that you may have heard earlier in discussion. And again, for those of you that may not be familiar with it, it consists of 4 different components, being the community themes and strengths assessment, local public health systems assessment, the community health status assessment, and the forces of change assessment. Now, doing the MAP process, obviously you have to work with community partners. We work with a number of partners to help provide technical assistance as well as the implementation of the MAP process. And as you can imagine, it's very costly, it's very time consuming, so we really do look to our partners very much so to help us facilitate that. And then as the health department, we organize the community health stakeholders as well as any other members of our community around that MAP strategy. So we kind of act as that role model. Once we did our community health assessment, we provided a community health assessment report, which was developed, and it consisted of a number of community health priorities which were scored and rated based on those 4 assessments. And basically, the report outlined a number of health disparities which were summarized in terms of utilizing data. And some of the different data points we used assessment data, we used household survey data. We also used what's called Miami Matters data. It's basically a website that was developed in conjunction with one of our partnerships that provides a wealth of information about our community health as well as the health indicators. In the next slide, you're going to see, I'm going to show you all how we provide that information to our community. We also use Florida Charts, which is our health department's community health assessment resource tool set that has a wealth of health information for our entire state, and it breaks it down by county. And then with all of that information, we then compare it to the Healthy People 2020 standard. So this is the Miami Matters page that I was referring to, and this is available to our community, to our partners, our stakeholders. And what's really nice about this is it lists out the different indicators specific to Healthy People 2020, as well as some other indicators that we're monitoring. And it puts the information or our value for our community and then how we fare with 2020. So for example, this one is mothers who receive early prenatal care. This particular target year, which was 2012, we were 87.7%, and then the Healthy People 2020 target was 77.9%. So this kind of acts as a talking point when we meet with our partners, we show them this information, and then we even share this information with our community. And it's very easy to guide through this, it's very simple to understand, and so again, we use this as a talking point. And then we also have our community health assessment information located on this website as well. So now the next 3 slides, I know it's a lot of information, but I really wanted to provide real, tangible, real examples of some of our reports and some of our assessments. So this is an actual page out of our community health assessment report, and I just wanted to show you how we use Healthy People 2020. So for this particular page, this is to increase access to health care. And so we have at the top, in 2011, we had 42% of people in Miami-Dade County that did not have health care coverage compared to 19% nationwide. And then we have listed here the Healthy People 2020 goal, which obviously is 100%. We list out the challenges and our barriers, and then our opportunities, strategies, and partnerships to address this. This is another one. I can't read the top because this little bar is covering it, but again, it's just to show you how we use the data to compare. So we have the data from our Florida charts, linking up our different indicators, and then how we compare to Healthy People 2020. So again, you see we're using the Healthy People 2020 kind of as a comparable, as a benchmark. And lastly, decrease in healthcare disparities. Again, we have the different types of indicators specific to African Americans, how we fared in 2011, and then comparing ourselves to the Healthy People 2020 so that we can see where we need to be. So once we've done the community health assessment, obviously the next step is to do the community health improvement plan, which we use the MAP assessments to create that plan. And for our health department, that plan serves as a strategic plan to improve health as well as improve the quality of our community. And so we use it to ascertain as well as prioritize our community health issues, address any issues by identifying and aligning all of our resources, all of our partners that are available, and then obviously we take action. The Healthy People 2020 strategies and goals, essentially they act as a framework, they act as a roadmap. I know you keep hearing me say that, but that's really what it does. Why reinvent the wheel? It really does serve as that blueprint, per se, for us to use to know where we need to go. And then our health improvement plan, because we are an integrated health department, is aligned with our state health improvement plan, CHIP, which is developed by the state Florida Department of Health. So this is an example, like I said, we've got a lot of different examples. This is an example straight out of one of our community health improvement plans. I'm sure you all see that it says Healthy People 2010, and that's because our new community health improvement plan is in draft form, so I still wanted to share with you all an example of one of our improvement plans, or a page from one of our improvement plans. And as you can see with this particular one, it's access to care, and we have listed right at the top the Healthy People 2020 goal, and then what objectives from Healthy People 2020 to address this goal, our local strategy, our outcome objectives, how it's aligned with our state health improvement plan, that particular goal, and then the partners that we work with to try to address this particular the strategic priority. So again, I just wanted to share with you all an actual page of that document, and if at the end any of you all are interested in having copies of this information, feel free to email me and I can email that stuff to you. Okay, so this page is an example of the Florida Health Status Assessment. This is from our state health improvement plan, and I just wanted to share with you all what that looks like on their end of the assessment. And again, on the left-hand side, they have all their the different indicators for the state, and then they have the particular year, and then how they compare or how we compare ourselves to the Healthy People 2020 goals, the state rankings, the U.S. rank, as well as the Florida rate. So again, I just wanted to show you all how we're doing this both at the local level and then at the state level. And then this is our CHIP, this is our state health improvement plan for the 2012-2015 year. So this particular area is for health protection. And what's really nice is how they have listed out the goal and then the strategy and then the list of the different objectives to address that particular strategy and to achieve that goal. And on the left-hand side, there's a list or like a legend of the different national and state goals and objectives those objectives address. So for example, objective health protection 1.1.2, it has 3 symbols. One being that this particular objective was linked to the Healthy People 20 goals, and then it's also linked to the key health disparity objective, and that it's also a national prevention strategy. So I just wanted to share with you all how that information is outlined in both our local level plan as well as our state plans. So with strategic planning, we use Healthy People 2020 both in community health planning, but also as for our agency strategic planning. And our particular strategic planning process is designed to identify priorities as well as meet our vision and our values. So our strategic plan acts as a blueprint to improve health, and just to share with you all what our 3 strategic priorities are for our health department is prevention and preparedness, return on investment, and service excellence. And there's a number of performance indicators and deployment activities which we make sure are in alignment with our State Department of Health as well as the Healthy People 2020 health indicators. And so basically all of our indicators that we're monitoring are, we use the Healthy People 2020 again as a benchmark as well as for their objectives. And then we track all this information in what's called the strategic plan tracker. So we obviously have the strategic planning process and have the different actions that we're doing, but then how are we tracking those actions and making sure that they're happening? So very often we come up with an assessment, we come up with a plan, and then who's monitoring to make sure that we're actually doing the activities that need to occur to help achieve our goal. So this is just the interface of our SharePoint site that we use within our organization. It's where we house a strategic plan tracker as well as a number of resources like Healthy People 2020. And as you can see, we have our public health model on there. And I just wanted to show you all what our tracker looks like. And again, this is just a very basic Excel sheet. It's nothing special. But I just wanted to show you how we're tracking our activities. So let me just show you. So this has our strategic priorities as well as our goals. And then we have here crosswalk linking key activities in the strategic plan guide to guiding documents. So we have it how it's linked to our state health improvement plan, how the different objectives, if it's linked to our Healthy People 2020, if it's linked to our scorecard, which I'm going to go into in the next slide. And we do have a PMQI, a Performance Management Quality Improvement Committee that is responsible for updating this information on an ongoing basis. And then we also have a number of senior leaders that are responsible for the different core activities to make sure that they're occurring. So it's just real basic, but I just wanted to show you how we're doing this. So now you heard me mention about community and programmatic health indicators. We have a number of health indicators that we use to track our community health, as well as manage some of our internal processes, as well as support decision making. And the methods by which we select and collect and integrate this data, again, are dependent upon the requirements of our customers and partners, as well as the Healthy People 2020 goals and objectives, and then the mandates of any of external sources. So, for example, we have a number of programs that are that are funded, that are grant funded, so of course we have to make sure that we meet those requirements. And then all that indicator data is maintained in a results scorecard system. So let me just show that to you all. And again, our results scorecard system is a centralized system where we house all this information. And for the sake of time, I'm going to run through this really quick. This is just a glimpse of the interface of our results scorecard system. And this just shows you the list, to give you an example of some of our indicators. So on the left-hand side, these are a list of our indicators for community health and planning. And you can see the ones that are linked to Healthy People 2020. We have it listed there. You can see the how we're faring, if we're going up, how we're going down. So that T in the mapping process, that tracking, this is how we're tracking, how we're doing, if we need to increase our activities, if we need to change our activities. So this is how we're monitoring our information. And if I were to click on each one of these indicators, it would then link to the Healthy People 2020 objectives that are for this particular indicator. But for the sake of time, I won't go through all of that. So this is my last slide. In summation, Healthy People 2020 supports our health efforts. It helps communicate the national health agenda, vision, and strategy, provides an overarching national level goals and services and roadmap. It provides guidance to health departments to improve health, and then also it helps our partner organizations be able to set priorities and assign tasks to achieve objectives. So in summation, Healthy People 2020 helps us improve our community's health. Thank you.